So I grew up in Northern California, about 30 miles east of San Francisco. I was actually born in Oakland. Played a lot of sports. Our football team in high school was #1 team in California 2 years in a row, which was a really cool experience. And that took me into college to play football. However, when I got into college, a couple of injuries, I became very well acquainted with the orthopedic surgeon. And from there, just multiple discussions occurred and got me interested into medicine. And that's how I ended up in medical school. Growing up, nobody in my family was a doctor or had even thought or talked about becoming a doctor. Once I got to medical school, I became very interested in vascular surgery in my clinical years, so in my 3rd year of medical school. So I think the one thing that really sets Deborah apart from other hospitals is that all patients are essentially vascular patients, whether it be cardiovascular or peripheral vascular, but they're all the patients presenting with the same comorbidities, and oftentimes very challenging and very complex disease processes go hand in hand with vascular disease. My patient philosophy and what I try to impart upon the fellows is that we realize that we're taking care of very complex disease pathologies with regards to vascular disease. So it's extremely important that we set appropriate expectations with the patients, because there is really no cure for vascular disease. And oftentimes we're doing vascular surgery as a temporizing measure. The most gratifying part of the job is taking somebody through the whole process that comes in with a limb-threatening or a life-threatening problem, talking to them about the process, talking to them about how we're going to solve this problem, and then seeing them come through it and seeing them walk out of the hospital. All of those things are extremely gratifying.